Hi, my name is Ryan Molenaar, and my research paper is Understanding the Impact of Explanations on Advice Taking, a user study for AI-based clinical decision support systems. So for a summary, this article compares AI-based clinical decision support systems to explainable AI in the medical field. So DSS is a tool that doctors use to outsource mundane tasks, and this is through a series of inputs and parameters, and the AI will provide a recommendation, diagnosis, etc. The issue with this system, however, is that it doesn't provide explanations and it's difficult to follow the reasoning and decision-making process of the algorithm. Versus the XAI, it does provide this explanation. So this is an online user study that analyzes the impact of AI explanations on users' trust in the algorithmic recommendations as well as their behavioral intention. So the research methods they use is an online experiment user study through this platform, and they did an estimation task, which the users are presented with client history or patient history, and they're asked to make an initial estimate or diagnosis. Then they're given the algorithm's diagnosis, and then they're asked to give a final estimate, and they're asked to do this between both systems. And then they're also given a questionnaire that uses the Likert scale. So the data is both quantitative and qualitative in nature, and as all these different variables, and all of these seem pretty straightforward, except for the weight of advice, which is the degree to which the algorithm suggestions, with or without explanation, influences the participant estimate. So this analysis, they used box plot comparisons, the Wilcoxon sign rank tests, Spearman correlation tests, median and p-values, which you can see here. And then the results, the weight of advice was higher for the XAI compared to the DSS, which just means that users were more influenced by the AI explaining its recommendation versus not. This also was true for the questionnaire as they appreciated the explanation. Furthermore, despite low perceived explanation quality, participants relied heavily on the recommendation of both systems. And lastly, for the last two, confidence in estimation and explicit trust, as well as behavior intention, showed no significant differences between the two systems. And then lastly, my rationale for choosing this article was the final project. We're designing a movie recommender app, and we're going to use algorithms and AI to recommend movies based on preferences and behaviors. So I was curious to know if we should suggest movies and whether or not we should give explanation behind the suggestions. Thank you for listening.